Are you looking for a different type of healthcare? At Innovative Health and Longevity, we practice something called functional wellness. Functional wellness is concerned with the root cause of healthcare issues, not just symptom management. Consider this. If you had a rock in your shoe that hurt your toe every time you took a step, what would you do? Would you just take an aspirin to relieve the pain? Or would you address the underlying problem and shake out the rock? You'd remove your shoe, of course, and that's a great metaphor for functional wellness. At our clinic, we're passionate about helping our members remove the rock to become empowered and independent. We're going to start that process right now by educating you on America's healthcare crisis and helping you understand how the system is failing patients. We'll discuss some of the potential underlying reasons why you're not feeling your very best. And at the end, we'll give you a fantastic opportunity to come in for a one-on-one consultation to become a member at our clinic. Dr. Kadir is a board-certified medical doctor who is also certified in functional medicine. She is able to incorporate conventional FDA-approved treatments and integrative approaches to health. Dr. Kadir works with you as a partner and digs deep to truly address your underlying health problems. She has changed many people's lives. Is there a place for conventional medicine and pharmaceutical drugs? Of course there is. If I was to get into a car accident on the way home from work, don't take me back to Innovative Health and Longevity. There's no lifestyle change or holistic intervention that can fix my broken arm. Take me to a hospital with a skilled surgeon. But this is exactly what the conventional system has proven to be good at: acute crisis care. Research shows us that it's not the best approach for a proactive approach to wellness. Americans spend over $3.2 trillion a year on healthcare, and chronic but preventable diseases such as diabetes, chronic pain, heart disease, and even many autoimmune disorders are a huge portion of this number. In fact, 95 cents of every medical care dollar goes to treat disease after it had already occurred. Imagine a sink is overflowing and water is spilling all over the floor. Conventional healthcare runs down the hall, grabs a mop, and starts to mop up the floor. When the blood pressure goes up, a patient is prescribed high blood pressure medicine. When cholesterol is up, they get a statin. When they can't sleep, they're prescribed a sleep drug. Meanwhile, the sink is still overflowing because no one turned off the faucet. In the US, we spend more than $400 billion a year on pharmaceutical drugs, more than any other country. And while some of these drugs are life-saving, of course, many come with serious side effects, for which patients are prescribed more drugs. In fact, senior citizens fill between 9 to 13 scripts a year, taking an average of 5 to 7 drugs at a time. We've all heard the commercials. Got headaches? Take this drug. Side effects may include vomiting, diarrhea, or stroke. We throw money and prescriptions at health problems, and it's not making us any healthier. Among high-income countries, we rank worst in terms of health outcomes, equity, and quality. And we have the highest rate of death due to medical error. Physicians, on average, see their patients in 15-minute blocks, sometimes double-booked, because primary care physicians are paid both by their employers and insurance companies, mostly in a per-visit model. They have one eye on you and one eye on the clock. The system rewards doctors who see patients in bulk. We want to make it clear that we're not bashing these medical doctors. They are, in general, very passionate and care deeply about patients. We're concerned about the system they must operate in. What's this? A health insurance card. But does it really ensure health? As you now know, the answer is not really. Insurance reimburses for the system we just described, but it very often does not cover the things that common sense tells us actually creates and ensures health. It doesn't pay for a real education for how to manage your own condition. It doesn't help pay for healthy, wholesome foods. It usually doesn't pay for a gym membership. Insurance also heavily dictates what can and cannot be done to help a patient. It's probably obvious now why you've been struggling to get results in the conventional system. We're going to move on to describing our approach to health and how we help our members get such incredible results. There are 4 pillars of health: hormones, nutrition, fitness, and detoxification. You're watching our webinar because you're looking for a solution to your healthcare concerns, and perhaps you've already tried to fix things on your own. At our clinic, we customize programs of care for our members to not only uncover the true underlying cause of their health issues, but also to empower them to take control of the pillars of health in an easy-to-follow, individualized manner. So why are we as a country so sick, sad, and overweight? Let's talk briefly about exercise. Unfortunately, walking your dog and doing day-to-day chores does not count for exercise. As a country, we need to build more muscle mass and move more, but a fitness routine that works for one person may not work for the next. In fact, when it comes to certain hormones like cortisol, certain types of exercise can make the situation even worse. We'll talk more about this later. We are going to help you understand how to work out for your condition, and we're also going to build your body back up so you have the energy and drive to exercise. Next on our pillars of health, nutrition. Research is increasingly clear. Diet plays a huge role in maintaining health and managing chronic disease. But doctors in the conventional medical system only receive, on average, 19.6 hours of nutrition education across 4 years of medical school. And, of course, there are many things to discuss in a jam-packed 15-minute doctor visit, and nutrition often falls to the wayside. There's no one diet for everyone. It's also important to consider food sensitivities, which are very different than food allergies. You know if you have a food allergy. That's a life-threatening situation where you, say, eat a peanut and your throat swells up. Food sensitivities is more chronic, less acute, and often more difficult to diagnose because of delayed reactions. The offending food may not cause a reaction for 48 hours or more. If you have symptoms like headaches, trouble sleeping, stomach issues like IBS or gas, skin troubles like eczema or rashes, respiratory issues like asthma or congestion, your health woes may be related to food sensitivities. At our clinic, we utilize proper testing and a detox to customize a person's diet and ensure they feel the best they can. We think of stress in 4 ways: physical, chemical, emotional, and electronic. Physical stress, like car accidents or old injuries, can obviously impact the day-to-day quality of your health, and it's important to address underlying causes of physical stress instead of just medicating the pain. Emotional stress is firmly linked to health issues. Emotional stress is known to negatively influence blood sugar levels in diabetics and influence thyroid hormone levels. It's important to develop stress management habits like exercise, journaling, or prayer and meditation. It's also crucial to address underlying hormonal imbalances. Electronic stress, our constant attachment to technology, the pressure to always be on at work, and exposure to blue light from computers and phones can cause issues with our circadian rhythm, or wake-sleep patterns. There is increasing evidence that disruption of the circadian rhythm can lead to certain cancers, metabolic dysfunction, and mood disorders like anxiety or depression. At our clinic, we place a major emphasis on awareness regarding chemical stress. The skin is your largest organ. The skin is a giant sponge, absorbing everything it comes in contact with, from household cleaners to pesticides to beauty products to the additives of tap water. Unfortunately, in our country, there's little federal regulation to protect consumers from chemicals with questionable safety ratings, including known or suspected endocrine disruptors and carcinogens. Our bodies are designed to handle stress, whether physical, emotional, chemical, or electronic. But there becomes a point where a person's body is overwhelmed and suffers health consequences. It's important to build your body back up so you can better manage all types of stress. Hormones are chemical messengers that travel throughout the body, coordinating complex processes like growth, behavior, metabolism, and fertility. Look over this list of just a few of the known hormones. Who'd like to have more of the fat-burning hormones and less of the fat-storing hormones? It's a trick question. What you really want is everything in perfect proportions. even tiny imbalances can dramatically impact the way you feel. We are going to discuss 3 specific hormones, the first of which is estrogen. On the right, you can see a body type drawing. If you suffer from a hormonal imbalance that causes stubborn weight gain, the distribution of body fat can provide clues to the type of imbalance, although, of course, proper hormone testing is crucial. Estrogen is an important hormone for both men and women, but if imbalanced, it will cause extra body fat around the hips and upper thighs. High estrogen levels can be caused by a category of chemicals called xenoestrogens, an endocrine disruptor. These endocrine disrupting chemicals, like parabens, are commonly found in conventional beauty products, plastics, chemicals, and artificial food ingredients. Estrogen dominance, more estrogen than progesterone, can occur throughout a woman or man's life, but is especially common during a menopause. Blood sugar imbalances, like in diabetes, can also trigger estrogen issues. Estrogen issues can also occur when a person's body cannot detoxify properly. Cortisol is a steroid hormone that regulates a wide range of processes throughout the body, including metabolism and the immune response. It also has a very important role in helping the body respond to stress. But chronically high cortisol levels can cause weight gain, especially around the belly. It will also cause fatigue, depression, trouble concentrating, and blood pressure issues. If you struggle to get through the day without tons of coffee, it could be a cortisol problem. If you have a thyroid disorder, understanding how cortisol impacts you is even more important, as high cortisol will lower your TSH, or thyroid stimulating hormone, block the thyroid hormone at its receptor site, and lower the conversion of T4 to T3, the only kind of thyroid hormone that your body can actually use. Thyroid is a hormone of great interest to many of our patients, as we see many people with hypo or hyperthyroidism. Hypothyroid issues can cause fatigue, weight gain all over, thinning hair, cognitive problems, insomnia, and generally make you feel terrible. Conventional medicine's approach is to medicate thyroid patients with a synthetic thyroid replacement hormone, but this approach does not address the underlying reason someone isn't producing enough thyroid hormone. The truth is that 90% of hypothyroid causes are due to an autoimmune disorder, mostly one called Hashimoto's. With an autoimmune disorder, when the body's immune system attacks its own tissue, there are many natural ways to calm the immune system and better manage the condition. It's important to consider all the other underlying health issues we've already discussed and take a whole body approach to managing a thyroid problem. Last but not least, we have one more body type to discuss. This body type relates more to an organ, the liver. When you see someone with this body type, you may assume they have a beer belly, but we think more about this factor. This relates to detoxification. Your liver has to process all the chemicals, all the imbalanced hormones, all the medications you take, while producing bile, activating enzymes, synthesizing protein, metabolizing food, and cleaning the body. When overwhelmed, a sluggish, fatty liver can cause a host of issues, including weight gain, fatigue, brain fog, and high blood pressure. It's not enough to tell a patient in this state to eat better and exercise, because, as you now know, a person's specific nutrition and exercise needs vary, and there are so many other factors at play, including stress, chemicals, and hormones. This is why it is so important to do a proper, safe detox, as it will set the stage for the rest of your journey back to better health. One of the most common phone calls we get at our clinic is from new members who say, "I feel really terrible, but my doctor ran blood work and said I'm normal, so I'm looking for someone who can truly help me understand what's happening in my body." Being told you're normal when you feel terrible is so frustrating, but here is why it happens. The blood markers reference range is defined as the values that 95% of the normal population falls within, and that range is determined by collecting data from all the lab's results. But you don't get your blood work done because it's a beautiful sunny day and you feel awesome. You get it drawn because you feel terrible. so normal is based on an unhealthy population. Functional wellness has tighter ranges that are based on studies of people who feel great and have no health issues. In functional wellness, we also test more or different lab markers. For example, most doctors in the conventional medical system only test one thyroid marker, thyroid stimulating hormone, as insurance typically will not reimburse for further testing. But this is an indirect, inadequate marker for thyroid status and does little except aid the doctor in determining how much synthetic thyroid hormone they should prescribe. Again, not addressing the underlying reasons that a patient is suffering with hypothyroidism. At Innovative Health and Longevity, one of our core philosophies relates to why versus what. Conventional medicine is worried about what you have: hypothyroidism, diabetes, hypertension. At our clinic, we know a proper diagnosis matters, but we are also concerned with why someone has that problem. If you don't ask the right questions, or ask any questions at all, you don't get the answers. All you get is a disease-drug model of care, and research tells us that this mindset does not result in greater health. To get on the path to wellness, it's important to treat the whole person with a clearly defined path. Let's discuss coming into Innovative Health and Longevity. When you come into the clinic, we will sit down knee to knee for our initial wellness evaluation. The purpose of this appointment is to develop a program of care for your condition. We want to make sure that we're a good fit for what you need and that you're a good fit for our programs. We want to learn more about what you're going through, what your goals are, and begin to uncover what other practitioners have missed in the past. We request that you come on time and complete your paperwork in advance. This ensures you get the most time with our practitioner. Additionally, for your wellness evaluation, we ask that you bring your spouse or significant other to the appointment, even if they aren't being seen as a potential member. There is so much information sharing and decision making in that first appointment that it is crucial to have your spouse present, as it is hard to go back later and relay it all to them. So we ask that you not only bring them to the consultation, but also have them watch this webinar beforehand, so we can dive right into discussing your case and specifics in the appointment, and not have to spend our valuable shared time doing this pre-education. Common questions. The first is, do you take insurance? No, insurance does not cover what we do. Insurance covers the conventional system, which, as you already know, does not have the answers you need. The second is this affordable? Yes. We work with many different types of people, from retirees to single parents. If this is a good fit for you, we will find a way to make it work for your budget. Another question is the diet weird or the exercise hard? Absolutely not. We believe in teaching people sustainable habits that they can practice their entire life. Nothing weird, we promise. Everything we recommend is grounded in the latest science. Do you have to be local? We are located in Uniontown, Ohio, but we work with people long distance all the time, which means we can not only help your mother-in-law who lives out of state, but also that we can talk with you over the phone if you can't always make it into our office for appointments. Last but not least, we urge you to stop procrastinating and come in for this initial consultation. Most people spend months, if not years, pondering major life choices before taking action. What is lost in the downtime is a more vibrant, healthy life. We cannot wait to meet with you and guide you along the path to wellness. Call today to schedule your consultation and start your journey back to good health. Thank you for watching.